Hi everyone, I'm Mohanya Doc. In this video, I'm going to discuss asthma part 2. In this video, I'm going to focus on classification of asthma, the differential diagnosis of asthma, how asthma is treated, and how asthma can be prevented. If you like this video and benefit from it, hit the like button, share, comment below, and subscribe. For you to understand this video better, watch part 1 of this video where I've discussed what is asthma, all the causes of asthma, and how asthma happens or occurs. Asthma is a prolonged condition of the airway where your airways narrow, they also swell and also produce excessive mucus. This excessive mucus and the narrowing of the airways and also the swelling of the airway make the diameter of the airway very small, hence creating difficulty in breathing. Asthma can lead to a life-threatening attack or what we call asthmatic attack. For some people, asthma is a minor problem, and for others, asthma is a major problem which even interferes with the daily activities and also can lead to an asthmatic attack. Asthmatic attack is can be very fatal. Asthma is classified into 4 types or 4 stages. For you or for your dog to classify asthma, what we consider as doctors, we consider the timing of your symptoms. We also consider the frequency of your symptoms. We also consider the physical findings, and also we consider the outcomes of some of the diagnostic tests we do for asthma. There are 4 types of asthma classifications. One, we have intermittent asthma. Intermittent asthma is whereby a patient with asthma has daytime symptoms less than 2 times per week, and also these patients have asthmatic nighttime symptoms greater than 3 times per month. Number 2, we have mild persistent asthma. Mild persistent asthma is whereby the patient has asthma daytime symptoms greater than 2 times per week, and also they have asthmatic symptoms or nighttime symptoms 3 to 4 times a month. 3, we have a moderate persistent asthma. This is an asthma where the patient experience daytime symptoms 7 times a week, and also they experience nighttime symptoms more than once a week. And number 4, we have severe persistent asthma. This is where the patient experiences daytime symptoms every day throughout the day, and also they experience nighttime symptoms all night and throughout the night. How do we understand it's not asthma, it's something close to asthma? These are what we call a differential diagnosis. Differential diagnosis is a condition or a list of conditions that share the same symptoms as a particular disease. Conditions that may appear like asthma, we have we have voice cord dysfunction. Voice cord dysfunction is in your larynx or your voice box. We have those voice cords that produce sound or speech. These voice cords sometimes can come together or come into the midline, obstructing the voice box. This will make air flowing through the voice box to struggle through the retro space that has been left, resulting to signs and symptoms that are close to asthma. Number 2, another differential diagnosis of asthma, we have cancer of the trachea. This is the trachea in this diagram. First, we have the voice box, and number two, we have the trachea. If you have a cancer of the trachea, this cancer or the growth within the trachea will obstruct air flowing through the trachea. This will make you have the symptoms that appear as those of asthma. Three, we have the cancer of the bronchus. Cancer of the bronchus will make this space narrow, resulting to obstruction of air. This also may present like asthma. We also have a foreign body. Children may swallow and aspirate the foreign materials or foreign bodies. These foreign bodies may enter into the trachea and then move downward into the bronchus. This will result to obstruction of air flowing through these bronchus, resulting to symptoms that may appear like they are asthmatic. We have another condition we usually call COPD. COPD is the chronic obstructive pulmonary disease. This is a group of diseases that usually block air flowing through the bronchus. COPD include two diseases. Mostly we have the emphysema and we also have the chronic bronchitis. Those are the two conditions that make COPD. These conditions usually appear like or present with symptoms that are similar to those of asthma. We have another condition we call diffuse panbronchiolitis. This is another condition that presents with wheeze, cough, and shortness of breath, just like asthma. We also have congestive heart failure. When your heart fails or your heart is unable to meet the demand of the oxygen, there is a reduction in what we call the function of the heart in heart failure. This will result to your lungs or blood will stagnate and there will be a backflow pressure into the blood vessels that line your lungs or your alveoli. This one will make the water that is in the blood to move across from the blood vessel into the lungs. This will make your lungs more watery. Watery lungs cannot be able to stretch. This patient will appear like they have difficulty in breathing. They will also appear to have a cough mostly at night. We also have another condition that also presents like asthma called JAD. JAD is a gastroesophageal reflux disease. This is a digestive system disorder whereby your stomach acid or other stomach contents will flow back into the food pipe and may end up uh, entering into the weed pipe. These JAD present also like asthma. And last, we have a condition we call a sinus infection. Most of the people who have sinus infection also appear to have bronchial asthma, where they have wheeze, cough, and shortness of breath. How do we diagnose asthma? Asthma is diagnosed through tests. Some of those tests are done to exclude other diseases that will mimic asthma symptoms. We also diagnose asthma through asking questions and also through what we call physical examination. Physical examination is where your doc will examine your chest and listen your chest with a stethoscope. How do we treat and prevent asthma? Treatment of asthma will depend with the diagnosis of the asthma because asthma is treated according to severity. Some of the diagnosis or diagnostic tests your doc will do include the lung function test. Lung function test is a test that is done to determine the amount of air that is moving in and out of your lungs when you are breathing. Those lung function tests include one we have a spirometry. Spirometry is a test that is used to estimate what we call the narrowing of your bronchus when you have asthma. It is done by determining the amount of air you can be able to exhale after taking a deep breath. It also determines how fast you can breathe out the inhaled air. Also, we have another test, lung function test we call a peak flow. Peak flow is a meter that is a simple device that is used to determine the amount of air that you can be able to exhale out, how hard you can be able to exhale out. And another test that we do, we can also give medications. These medications, one we have a bronchodilator. A bronchodilator is a medication that when you are given, your airway will dilate. When your airway dilates, we are going to test how much air is now able to flow into your lungs and flow out of your lungs. Then we have another drug we call methacholine challenge test. Methacholine challenge test is whereby you are given a drug to inhale. This drug usually go and make your airway or your bronchus to constrict. If you respond to this drug by having a severe constriction, this one is assumed that you have asthma. Other tests, we have an X-ray. An X-ray is used to evaluate your chest and your lungs. And also we have a sputum. Your doc may also request you to do a sputum. Sputum will be checked under a microscope and to check the white blood cells. These white blood cells include eosinophils. The eosinophils are the white blood cells that are involved in asthma. Treatment of asthma is a broad one, depending on age and also depending with the severity. Someone who has intermittent asthma will not be treated the same as someone who has severe asthma. Also, the age of the patient matters when it comes to treatment, and also the type of allergen that trigger your asthma also is a determining factor. Drugs that you may use to treat asthma, we have short-acting bronchodilators and long-acting bronchodilators. These are drugs that are used to expand your airway. We also have other drugs that are called corticosteroids. Corticosteroids may come in form of oral drugs, may also come as inhalers, they may also come as injectables. Corticosteroids are used to reduce the swelling that present in asthma, the swelling in the bronchus or in the airways. We also have the drugs that are called the respiratory modifiers. These are drugs that help to relieve the symptoms of asthma. Other drugs that may be used are allergen or allergy drugs. These are drugs that in asthma, we say that there is a overreaction of your immune system to harmless substances that we call allergens. So there are drugs that can be used to try to make your immune system not to overreact to these allergens. And also we have other alternative medicines and supplements that can be used to treat and prevent asthma. If you like this video and benefit from it, hit the like button, subscribe. I'm Wahinya Doc. Thank you.